Hello everyone, welcome to sqadia.com. I'm Hina Khan, and today the topic of our lecture is intellectual disability, which is basically characterized by significant limitations even in the intellect of the individual, as well as the behavior of the individual is also quite limited, to such an extent that his day-to-day normal life is affected by these limitations. So this is what we are discussing today. The first section will comprise of the mental retardation. Now, when we say that a person is mentally retarded, basically his capabilities of social interact are also retarded along with it. We'll be defining along with the epidemiology of this particular condition. Along with that, we'll be particularly defining this condition. As well as we'll be discussing the adaptive functioning of the individual along with this mental retardation. So if a person is basically suffering from this kind of a mental retardation, he basically adapts to his environment and adapts to his condition as well. In the second section, we'll be discussing the impaired intellectual functioning along with it. The genetic abnormalities, they serve as a risk factor for such impaired intellectual functioning. We'll be discussing them, and along with them, the other risk factors will be discussed along with this genetic abnormalities. In the third section, we'll be discussing the categories of mental retardation. Obviously, we'll be discussing the different severities that range from the mild, moderate to severe mental retardation. How do we get along with the clinical assessment in such cases? How do we manage such cases? This will be discussed along with the clinical presentations of such mental retardation. In the fourth section, we'll be primarily discussing the clinical features of mental retardation. So there are a lot of syndromes that are categorized with the mental retardation, in which we include basically the Down syndrome. Then we have the autistic spectrum disorder, also known as the autistic syndrome. Then we have the Prader-Willi syndrome. So all of these syndromes are quite significant, and the major factor over here that is similar in all of these syndromes is the mental retardation of the patient. In the fifth and the final section, we'll be discussing the management of such mental retardation. How do we go about to treat such patients? How do we provide help to such patients? Obviously, the prognosis is quite different depending upon the comorbidities, depending upon the environmental factors of that individual. But still, the aspects that are quite important to consider will be discussed over here. How do we basically develop those communication skills to take the history from such patient and help those patients get out of those situations? The health facilities that are provided for such individuals would also be discussed in this final section. So I hope you want to learn more about these intellectual disabilities. So do watch the other sections of this lecture as well.